Well, joining us now is Dr. Liam Fox, previously a member of the government, Conservative MP for North Somerset. So much to talk to you about. I wonder if I might be able to ask you about energy bills, if that's OK. We're just hearing from Ofgem that vulnerable customers are being ripped off by big energy companies in all sorts of ways. I'm sure that some of your constituents are going to be affected by that, not least those that are on prepayment meters. Is there anything you can do about it?
Well, I think it's something that the big energy companies need to look at. The government, the taxpayers, you and I, are putting in a lot of money to help, especially those on lower incomes. And I think the energy companies need to be doing the same to make sure that tariffs and charges are as fair as possible and that the money that the taxpayers are putting in will therefore go as far as possible.
Yeah. Do you think the government is doing enough? I mean, there were some suggestions that the government shouldn't get involved in I mean, obviously they're coming up with a lot of money, but they shouldn't get involved in support schemes to help customers because that was too much of a nanny state. Given that we're hearing from Ofgem that, for example, people on prepayment meters are just suffering at the hands of several of these energy companies, is it an area where the government should perhaps look at that again?
Well, I think it's something that Parliament will want to look at. I'm sure that select committees will want to look at whether the public money that's being put in, an extra 26 billion that the government announced last week, which is more than half of our defence budget, to put that in perspective, that needs to be used properly. So I think that the Parliament, all MPs will want to ensure that that money is being used in an effective way to help those, especially at lower income levels.
Your previous Prime Minister said that we would be helping people with energy caps for 2 years. The new Chancellor has said we'll look at it again in April. Is that right?
Well, it depends on what, of course, is happening to energy prices. The reason that we're having this high level of support is because of the Russian invasion of Ukraine and how that pushed up oil and gas prices around the world. If those prices start to fall again, clearly we don't want to be having taxpayer subsidy where we don't really need to have that because we've got lots of other priorities where we could be spending that money. So it's always a balance about where the government uses taxpayers' money. You don't want to be putting subsidies in unnecessarily, but the government will look at it and see where we need to target that support. We've seen some evidence of those global prices in oil and gas beginning to fall again, but it's anyone's guess over the winter what will happen. We don't know how severe the winter in Europe will be, what demand will be, and what that will do for prices. None of us can predict that.
Something that is an area of expertise for you, of course, is Brexit. We're hearing from senior European figures saying it's wishful thinking that we could get closer to the EU when it comes to trade deals with a special deal, without agreeing to free movement of people.
Yeah, I'm sure they're right. And I think this idea of, first of all, I think politically reopening the debate on Brexit is the very last thing that we need at the present time. And this talk about a Swiss relationship, you know, for the Swiss, they have to pay into the European budget, they have to accept free movement of people, and they have to accept European laws over which they've got no control. I don't see that as being in line in any way, shape or form with the spirit of our referendum or our exit from the European Union. I think it's a political non-starter. It's a waste of everybody's energy and we should just get on with the job in hand.
You say get on with the job in hand, but we don't have enough people to get on with the job in hand. There are hundreds of millions of job vacancies, I think 1.5 million job vacancies at the moment.
Yes, and we also have a very large number of people who are out of work, or an even bigger number of people who are not economically active.
So what are we going to do with them?
So one of the interesting things about the budget, and something that a lot of us have been talking about, is why is it so many people have chosen not to work? As we know, a lot of people from the age 55 bracket onwards have chosen not to work since the pandemic. I think we need to try to understand why that is and try to find if we can find attractive ways to bring these people back into the economy, whether that's part-time or otherwise. Then I think the other thing to remember about Brexit and immigration is this, that we are needing to deal with illegal immigration. But the point of Brexit wasn't to stop immigration, it was to give us control of immigration. And I think that where there are areas of the economy where we need more skilled people more quickly, that I think that we should use those freedoms of Brexit to try to achieve that. The whole point of Brexit was to give us back control. It wasn't to have any one policy imposed upon us.
Two questions as a result of what you said there. If the government tries to make coming back to work for the over 55s more attractive and that doesn't work, do you go for less attractive ways to get them to come back to work?
You know, I think you try to encourage people back into the
What if
workforce.
they don't, though?
You can't force people into the workforce. This is a free country, and if people choose not to work, and they've got the savings, for example.
Yeah, but you can look at their benefits, can't you?
Well, if people have savings and they're not on benefits, for example, they're entitled not to work if they can afford to do so. People have put money aside. I think we want to try to encourage more people back into that workforce, because if we don't have the domestic workforce, you've got two choices. The jobs don't get done, or you have to bring them in from elsewhere. And people need to have to, I think, as a national conversation, we need to decide, which of these options is most attractive to us. We do need to have a growing economy, and that means a workforce that's becoming either bigger or more productive, or both. But if we can't do that domestically, we can't just leave the jobs unfilled.
No, but we need a more skilled workforce, as you were saying there. That takes time. There are skilled workers in Europe who could come and fill those jobs for now. Yes,
and if as I said, the point of Brexit was to give us control over migration. And if we need...
So you're not rejecting that idea to bring skilled workers, more skilled workers from Europe?
No, I'm absolutely not. And I think that we need to use our freedoms to be able to use those powers to be able to match the requirements of our economy with those skills that may exist elsewhere. What we can't have is free movement of people, where people are coming to the UK who may not have the skills that we want, but ultimately become able to use our public services or our benefits.
The PM also said we're in control of our borders now because we are no longer attached to the EU, but we still have to deal with countries like France, don't we, on a daily basis? So we're just picking and choosing.
Well, I think on the question of migration, I think we have to have a wider view, frankly, of what the problem is. And I would say you can break it into three parts. You've got those who are crossing from France into the UK at the present time. France has its own problems because of the Schengen Agreement, the free movement of people in Europe. Effectively, if you can get into the southern border of Greece, you can get to Calais because there are no restrictions across European borders. And then we've got a very big global problem, largely, I think, because of the pandemic, where you've had a lot of people who have been displaced economically by the pandemic, looking for a better life. And of course, we live in a world now where if you're a young African with a mobile phone, you can see what prosperity looks like. And if that's being denied to you, you will try to get something better for yourself. I think that's a normal human reaction. I think, therefore, we have to think of the upstream, if you like, elements of that migration problem, including how do we ensure that developing countries get their fair share of prosperity, and that post-pandemic we're not putting them at an economic disadvantage because of elements in the global trading system. It's a problem with a lot of different layers. And I think a lot of the political debate is too simplistic. Complex problems, as I would say as a doctor, seldom have a simple solution to them.
I'm glad you brought up the fact that you're a doctor. I'm reading in the paper today that Rishi Sunak says that the NHS is in his blood, but he pays £250 to see a doctor as soon as possible. He enrolls in an agency that will do that for him. How does he square that circle to say that, it's in his blood, the NHS is his number one priority, but if he's got an ache or a pain, he can just jump the queue?
Well, he's judged by what he does in terms of public policy.
What do you think?
I think that the government is judged by what it does for the NHS and how much money
do what I say, not as I do?
No, the government is judged, and politicians are judged by their public policy and what they do for the NHS. We've seen record sums going into the NHS. The NHS has two particular problems at the present time. Number one is inflation. So even with a big increase being put in, that will eat that up. And the second is we've got a chronic problem in the NHS with people being unable to be discharged from our hospitals.
Yeah, because of the problems with social care.
Well, it's partly that. It's partly, I would also argue, a lack of capacity inside the NHS. Now, it's a long time since I worked in a hospital, but even then, we had a problem with the inability to discharge patients who were perfectly ready to go from acute hospital.
You're coming away from my point. My point is, should somebody who says that the NHS is in his blood and he's responsible for where the money goes be jumping the queue by paying £250 to see a private doctor rather than wasting a fortnight like the rest of us?
Well, it's the Prime Minister and the government are judged by what they do for the NHS.
What do you think?
What they do with their private money is up to them.
Would you do that?
I don't have private insurance, but I don't in any way think that people should not do that if that's what they choose to do. And remember, everybody does that.
Even if they're the Prime Minister.
Well, and
I mean, what does that say about the optics?
Well, anyone is entitled to do that. This is a free country, and it cannot be that we tell some people that they cannot do that. The government is judged by what it's doing for the NHS, and the NHS is getting a lot of extra money. We're trying to deal with those problems of capacity in the NHS, and the fact that the NHS is suffering from a huge number of job vacancies at the present time, which people are not going into. So that's not going to be helped, nor does the debate get helped.
It's some rich bloke who is telling us how to live our lives and taxing us more, and yet he can jump the queue when it suits him.
Well, the Prime Minister's job is to make sure that the public provision of health in this country is as good as it can be. Both his time as Chancellor, now as Prime Minister, we're seeing record sums going into the NHS. That's the job of politicians.
But can you appreciate how that might not sit well with my viewers this morning?
Well, lots of people in this country will choose to use either the savings or private health policies to be able to get private health care. Every time someone does that, it's less strain on the NHS. I mean, if you do want to get rid of private healthcare, you'll get an even bigger strain on the NHS. The government's job is to make sure the NHS is well run and is well funded. And under Rishi Sunak and this government, I'm confident it will be.
So you don't think for one second that people will find it, they'll have to hold their nose when they read about this story?
Well, people will get private healthcare through their companies, through
some
their trade unions,
and
through the trade unions in some cases. So I don't see why that's any different. As I said, the job of the government is to make sure the NHS is well run and it's well funded.
Okay.
And that's what's happening at present.
OK, now I know Scotland are not in the World Cup. I'm sorry to rub that in. But how did you find the games yesterday?
Well, I'm a little worried that Iran could get 2 goals against England. And I'm a bit...
I think they got 1 goal against Scotland, though, didn't they, last time you played them? And it was a draw?
That is not a bar that I would necessarily apply.
OK.
And I think that the Welsh will be disappointed with the draw. So it's going to be an interesting tournament. There's a lot to fight for still.
And who's going to win?
I have no idea.
Argentina?
I really have no idea.
As long as it's not Argentina, frankly.
I don't really have any countries that I don't want to win. And, you know, something that a lot of people have been saying is, can we just talk about the football and not try to politicise every single bit of it? And if we can get back to sport as sport, so much more helpful. And, you know, if we have fewer TV commentators lecturing us about climate change and immigration and other issues and actually still talk to us about football, I think a lot of viewers will be a lot happier. OK, it's good to talk to you, Doctor. As always, thanks very much indeed for joining us. Thank you.